Hello, my name is Mbarara and I'm a lecturer here at Mbarara University of Science and Technology. I welcome you to this guided field tour, and I'm very happy to take you on this. So this is Mbarara University of Science and Technology. The university was established in 1989, so you can do a quick math. We are under 35 years old. That's fairly young for a university. The purpose of the university was to train more doctors, was to design a unique community-based medical education program that's able to train a doctor that reaches out to the community and is able to understand the needs of the communities that we serve. So we have a huge ratio. Every doctor is having 20,000, but also we understand that access is very poor. A lot of people have to travel more than 5 kilometers to reach a healthcare facility. And for that reason, many patients resort to non-formal healthcare facilities, as we're going to see later on in our tour. Our university offers a unique community-based medical education program. And in this program, our medical students, including nursing, pharmacy, and laboratory sciences students, spend at least 6 weeks in the community. And the purpose of this exposure is to lead the students to work closely with the communities that are similar to those where the patients come from. During this 6 weeks period, students will spend time at the health facility and interact closely with the health workers, but also more closely and more importantly with the communities. And during this time, they will interact with the informal sector that provides healthcare services. And these include traditional healers, bone setters, and traditional birth attendants. Now you may ask, why these informal healthcare services? The statistics show that more than 50% of Ugandans will encounter a non-formal healthcare practitioner before they arrive at the health facilities. And so it's very important to understand this connection between this informal healthcare sector and the formal healthcare sector. During the field visit, we will see examples of these caregivers, and we'll understand that these are people that are closely trusted by the communities. It's very important to expose our students to these informal health caregivers because we want to understand how they deliver the services. We also understand that some of the practices may be dangerous to the patients. And so understanding how they provide the service will help us improve their caregiving services, particularly help them to understand when cases are complicated so that they can refer these cases to the healthcare facilities for further management. And we have obviously heard that traditional birth attendants have not been working very closely with the healthcare facilities, and in fact there was talk of banning them, absolutely. But this is very difficult to implement because of reasons that they live in the communities and they're trusted by the communities.
Dr. Alan Twesigomwe. I work with the Rampara district, and now a new district, as the district health officer, or the person who is in charge of health services and health service delivery in the district. At district level, I will begin with the lowest level of health service delivery, and that is the community VHT system, which we work with a lot. It's a group of people that to some extent have received some level of training. They are not health workers because they don't have any formal training, but they have received some level of training to support the health system at community level. And they specifically do community mobilization and support a number of community health programs that run within their communities. In some areas, they also support in distribution of medicines, especially the medicines for malaria and other common illnesses, including diarrhea in children. So they support a lot at that level. When we move from that level, we go to the health center 2. The health center 2 comes at parish level. And the health center 2 is, in the health system, we consider it the lowest level of health service delivery on the system. The health center 2 usually has an enrolled nurse, an enrolled midwife, and a few nursing assistants and porters and askaris to support the minimum basic healthcare service delivery. And specifically here we focus on treatment for malaria, treatment for simple illnesses in children. Yeah, but the major service that is delivered at this level is immunization. And this is really considered one of their outputs at Health Center 2. Now, when we move from the Health Center 2, we go to a Health Center 3. And the Health Center 3 here is at sub-county level. And it provides basic emergency, obstetric, and newborn care services. That means we have a maternity ward. We also have, of course, antenatal care. We have laboratory services, minor laboratory services. At least they should be able to test for an HB. They should be able to run malaria tests, TB tests, and a number of others. So at Health Center 3, the difference is that now we are ensuring that people can be able to access maternal and newborn care services. Now, from Health Center 3, we go to Health Center 4. At Health Center 4, which is like this particular facility, at Health Center 4, we have comprehensive emergency obstetric care services. Now, in addition to the Center 3, we have a doctor or a medical officer who is able to perform a cesarean section, and we also have blood transfusion services. So these are the two major components that make it comprehensive. So that means that we are able to handle mothers with complicated deliveries so that they are able to access the service. We also have some specialized clinics, and those include the DM and the hypertensive clinic. We also have some psychiatric services. We also have ophthalmic services. We have an ophthalmic clinical officer who offers those services. And in addition, we also have HIV, comprehensive HIV prevention, care and treatment services. But these are also found at Health Center 3, the HIV care and treatment services. So in addition to that, we have those special clinics. Now, from the Health Center 4, we go to a district hospital, and that is at level 5 now. So the district hospital is more specialized, and we tend to see a lot of specialized care. So we have consultants, we have medical officer special grade in the 4 major disciplines of medicine, of surgery, pediatrics, and obstetrics and gynecology. So it tends to become more specialized. Now, for the districts, a district like this one, that is what we would be expecting to be the maximum level of care in the district. Now, from there, we move to the region, where we have the regional referral hospitals. And regional referral hospitals, now there it is more comprehensive services. We have a lot of specialized care. We have intensive care services. There's a lot that actually happens at regional level, which is at level 6. And then finally, we have the national referral hospitals at level 7. So Mbarara district has been running since July 2019. And its health services, it consists of, majorly they are public health services. We do not have a lot of private services that happen here. It is generally a bit remote, so people tend to use a lot of public health services. So we have 2 health center 4s in the district. We have 3 health center 3s and 14 health center 2s. That gives us a total of 19 health facilities that are offering services in the district. The district currently has an estimated population of about 150,000 people. And of those, 51% are women, and definitely that means 49 are men. Yeah, and the services that we offer is basically as I had described earlier at the different levels. Yeah, but important to note is the health services to mothers and children, that is reproductive, maternal, newborn and child health services. And that also ranges from deliveries, antenatal care, deliveries, postnatal, family planning, as well as immunization. And those are among the major services that we really look into. This is the outpatient waiting area. You can see it is generally congested, but we are hoping to have maybe a bigger space where we can have people able to sit comfortably. So they come and sit here, and their triage is done from here. I think you should have seen that. The triage is done from here, so they come and sit here as they wait for to see the clinicians. Okay? Now, we continue. This is one of the clinicians' rooms. This is also another. So as they wait, each patient enters one by one. They are seen by the clinician, and then sometimes the clinician may need to do some laboratory tests. So then from here, they go to the lab. So this is the lab. In the laboratory, we have some general tests that are able to at least support diagnosis, basic diagnostic tests. Yeah, but of recent, because this is like the head of the health sub-district, which was the health sub-district then, we have been able to acquire some new machinery. We are able to do PCR testing for exposed babies. We have a number of other simple tests that are also run from here. So from here, basically, the patient, after the results, they are taken back to the clinician for prescription, and that's when from there they are able to go to the dispensing area. The lab also has at least a number of equipment here. So we have a blood refrigerator. Of course, she's doing her microscopy work. From there, they come to the dispensing window, where they're able to get their prescribed medicines. Normally, when they are available, in situations when they are not available, then they are able to at least explain to them so that they can be able to go and buy the medicines. But this is the dispensing area, and then from here, then they exit out of the facility. We shall move to antenatal. Antenatal has its own wing. Mulireja bishemwe agandi Olireja wishemwe agandi. So this is the antenatal wing, and here she's called Sarah. She's a midwife, and this is one of her clients, and the husband, I presume. Yes. So this is antenatal. In antenatal clinic, they literally offer antenatal care services, and here we are looking at routine monitoring of pregnancies from the time of conception until this mother actually goes into labor. Services are offered here. A number of services that they offer here include, we have HIV testing, counseling and testing. We also have testing for a number of other things, including hepatitis B, including syphilis. And then they also offer routine medications for pregnancy, including iron, folic acid, including the IPT for malaria, and a number of other services that they offer. We also have A records room. Here they enter all records for the facility. This is basically where they handle anything to do with the medical records. But at the same time, we also have a number of data entries for people under HIV care and the treatment. That's where the computers are used for. There's a tent here that was provided to support the waiting area. So this one, we use it specifically for HIV clients for their waiting area. It became a bit difficult because, as you saw, the area is a bit congested. If you have an HIV clinic running, you have probably about 80 to 100 patients in a day, and you cannot have all those together mixed with antenatal and mixed with all these other areas. So we received support from one of our IPs, or the implementing partners, and they gave us a tent. So this really helps us to decongest the area and also at least help to avoid cross-infection. So we are going to the maternity ward. This is the maternity ward. And we would have wanted to begin from where admissions take place, but this is basically, this is like a postnatal area when mothers are being monitored, where they have completed their delivery process. Then they come here and they are admitted here. It is also a very small space. We are hoping that maybe with some future funding, we can make it a bit bigger, because it houses antenatal mothers, it houses postnatal mothers, including mothers who have had a cesarean section, including mothers who have had premature delivery. So it is a bit complicated, but this is the space that we have, and this is all that we can do with the space that we have. However, we are trying to lobby to see if we can get some support to have at least a number of wings for the different subpopulations of these mothers. Yeah, but this is basically it. Now you can see all the beds, for example, are full. Now when a mother is admitted, a new mother, then it means that we may have to shift one of the mothers, maybe who delivered a little earlier, to shift and maybe take them somewhere else, so that we can get at least space for a new admission. So it's a bit challenging. As part of our package, we also provide inpatient services. And inpatient services, literally these are admissions for anyone who has any medical condition or any surgical condition. Then we admit them in the general ward. And you can see the general ward there as well. Okay? This is the area where we do scrubbing from. It's a scrubbing area. Okay? The changing rooms are there for both male and female, and then after changing and scrubbing, then you enter into the operating room. So she's called Esther. She's a theater nurse. So on average, for a facility like this one, we conduct about between 40 and 50 cesarean sections in a month. And at least that is able to at least offer a service to these mothers instead of having to be referred to higher levels.
Welcome to the field, and I'm privileged to record this class for Dr. Eric Arts. Dr. Eric Arts was my teacher when I was at Case Western Reserve in Cleveland. So today we have before us Sekondina, and I'm going to ask her to introduce herself.
Amazina ganje ine Sekondina Mihangani. Mkazarwo mwaka.
My name is Sekondina, and I was born in 1949. Okay. So I'm now going to ask Sekondina how she started providing this service. And she's told us how old she is. So we're interested in understanding what motivated her and how she started. I moved here in 1966, but prior to that, my own mother was a traditional healer, and she also delivered babies, and she indicted me into the service, and I learned from her, and I felt motivated because I saw the nature of the service that she provided and how much the community appreciated her. So I started by providing the service having learned from my mother. So in 1980, the government offered us some training. Initially, I was hesitant, but eventually I accepted and went into the training. But she's telling me that it was very helpful for her in 1980 to train because she was able to learn to recognize danger signs such as bleeding and certain types of pain that she learned that were actually dangerous. She lives in a village here in Chinoni, in the heartland. As you have seen, we walk through banana plantations to get to her home. So I'm going to ask her about the nature of her clients and the kind of people she serves. My clients live in this village, but I have a lot of clients from outside this district. My reputation is quite favorable. I have people who get well and they sell my name to other clients. And what has made even communication easy is the cell phones. I have a mobile phone number, and I have clients' telephone numbers, and they also have my phone number so they can call me. But over time, I have also learned to handle more than just the mothers. I am treating the babies. I treat babies who have problems with their brain. I can assess a baby and I can tell what kind of illness it is. We have mentioned to you it's important that even though the traditional birth attendants provide service at home, it's very important to have a linkage with the health facility so that they can refer mothers who have danger signs or mothers who they will not be able to handle. So we want to see how that happens with her. First of all, I have learned that if a mother is HIV infected, I should not deliver her because I feel that I need additional expertise that I don't have. I have also learned that certain mothers who have danger signs such as bleeding should be referred, so I will not deliver those mothers. But also I have learned that mothers should have an ultrasound scan so that the nature of the baby and if there's any other underlying condition can be detected early, and that this mother can be sent to deliver in the hospital. But I also benefit from visits because I get to learn from the questions you ask, but also from the medical students that come to visit and the interaction. For me, I feel that that is some form of education. So I would like to ask her about how the community perceives her, how much they appreciate the service, and whether she feels a resourceful person in this community. So in this community, I am trusted, I'm respected, I'm a point of contact. People come to me for advice, and I recognize myself as a leader. Now I'm going to ask her about the client load, how many mothers she delivers, and other cases that she's able to handle. The numbers of babies have changed a lot in the past year because of, first of all, the corona epidemic. But before the epidemic, I used to deliver about 20 babies per month. But then during the lockdown, I stopped to deliver because I was afraid of catching the disease from my patients. So I referred virtually everyone. It's only last month that I started delivering, and in the past month I delivered 4 babies. But I think I noticed that now the numbers of deliveries are going down because the health facility at Chinoni, which we just saw by the way, now has a maternity unit, and the maternity unit and the services have improved, and many mothers are now choosing to deliver there. Now I'm going to ask her about the service area, the delivery room where she functions, and she will describe this for us, how large it is, and what sort of facilities are there. So I request that the mothers come with a polythene bag that we lay on the mattress, but I also have gloves and other things that are required for the delivery. And most of the mothers will come with these equipments, which are a requirement for me to be able to deliver them. And I have one room in my house which I have dedicated to the deliveries. Okay. Now I'm going to ask her about some of the medicines that she uses, whether she uses medicines from the hospital or whether she has herbs here in her garden or elsewhere that she uses. So I use medicines from the hospital, and these medicines help to stop the bleeding. I was trained on how to give the injection, so I can actually administer that myself. But I also have herbs, and we will show you some of these herbs. To point out some of the herbs that she uses, and she's pointing to this flowery plant. And she says she uses this to treat headaches. If a mother has headache, so she says this is a painkiller and that it will treat back pain. She calls it cheers, that's the local name for her. Okay, and you can see this dark flowery plant. She says she treats mothers who have dizziness, and she boils these leaves along with the flowers and makes a colorful drink that mothers drink if they have dizziness. So sometimes mothers consult me when their children are sick, and from my experience, she says this plant here that has this round yellow seeds is helpful in treating worm infestations. But she says she digs up and picks up the roots, which she boils and gives the children that will help to treat worm infestation. So although she predominantly delivers babies, she also serves as a pediatrician because she treats. But one good thing she says is she refers all the mothers that deliver to the health facility for immunization. She strongly advocates for immunization, which is a very strong indicator of her close collaboration with the health facilities. So she planted this tree in 1966, and she says you can see how old it looks. This tree has served a large number of patients. You can see that the stem has been shaved off many times, and I cut pieces of the stem and boil them, and it's used to prevent preterm abortions, pregnancies and deliveries, and many mothers have come here and chipped off pieces of the stem, as you can see, and taken it to treat themselves. now at the home of our next host, and I'll ask him his name and what he does here in the community, and that's how we get started. My name's Benon, and you may have seen a signpost of my name and my service at the entrance, and I provide my service in this village as a traditional healer, and he also serves as a spiritualist, and we are going to learn about the nature of the diseases and conditions that he treats. At Nozanzaba village, endwara nkachiz endwara zihezo kuzanzaba. He says he treats a wide range of conditions. He says he treats people who have mental problems. He calls it running mad. He says he also treats people who have bodily aches, who have anemia, who have body swelling, and he also says he's able to solve challenges of people who have been bewitched. So now I'm going to ask how he's able to tell what ailments people are suffering from. Is he able to make a diagnosis, and how does he do that? So he says he's able to tell how people are suffering by looking at them, listening to their stories, but he also says he invokes certain spirits. He smokes a pipe, and he also has some equipment that he shakes, and he's able to look at that and understand the condition. So now I'm going to ask for these different conditions that he is able to make a diagnosis, how does he manage them? Once he's made a diagnosis, he has herbs that he smears in the head for those who have headaches or mental health problems. But he says he has planted some herbs in the back garden, and he's going to show us later on some of the plants that he's able to use to boil and give them to drink to treat these ailments. Now I'd like to know, while he's able to make all these diagnoses, does he feel that he's not able to handle some conditions? We want to understand if he's able to refer some cases, or if he has any particular collaboration with the formal healthcare facilities. So he says that he does not treat HIV because he says that for HIV and AIDS he's sure that there's treatments in the hospital, and he also says he doesn't handle women who are pregnant. He thinks that those should be handled by the formal healthcare facilities. Now I want to ask him specifically about people who have been bewitched. How does he handle that? So he says that for people who have been bewitched, he believes that most of these poisons are given to people to drink or to jump over, and so he causes them to vomit, and that way he's able to cleanse them of these poisonous substances that they may have taken. So we are now at the backyard, and he's pointing to one of the plants he has planted here deliberately, and he says, "Wagwetomwe tango, korachi." So the name is Omwetango, which in the local language means to stop, actually, literally to stop. And he says he uses this to handle mental health problems. So they pound this herb and make a powder which they smear, which they would smear on the head, and would relieve the sufferer of any of the confusion or mental health that they would be suffering from. So we're going to walk to the back of this plantation, and we'll see more plants that he has planted. So the local name for the herb, he says, is Chimarampaka, which when translated is that it actually removes or takes away all the sorts of confusion or argument. And he says again, this is used to treat mental health conditions. Hati ogunogu. So I want to know how he uses it. Nogushekura, Naguno kushakura.
Kushakura.
So he says you will pick these leaves and pound them and make a paste, and then you smear that onto the head. Okay, so this. So he says this herb here is cooked, and they make a liquid that you drink to treat abdominal complaints, stomach pain, diarrhea. Okay.
Yarwe nkasiniga no gushaka guteka umunyindo umuti yarwe nkasiniga ayisiamura.
So this is used to treat respiratory tract problems, and he says he picks leaves and dries them and pounds them and makes a powder that induces sneezing, so that the airways can be cleared of that particular problem that people are suffering from. It's a very large leaf that has quite an aroma. So for males who are suffering problems of erectile dysfunction, he says this leaf, whose name is translated as to release, is used to handle that. This leaf and another plant that he's going to show us, which is lower down in the garden, he says he mixes and combines these two by pounding and drying and making a liquid that the men are drinking. Mr. Benon has dedicated a significant portion of his banana plantation to herbs, and this is another one which he combines with the other herb to make a concoction that is given to men who are suffering from erectile dysfunction. So Mr. Benon tells me that this herb here has a local name, Moihaho, which is to get rid of, and he says that this plant here is used to make a concoction that people will bathe to wash away bad luck. So you may recognize this plant. This is actually aloe vera, small leafed aloe vera, and he tells us that he's using this to treat fever, and they boil it and drink it. It's a fairly bitter plant. Yeah, it's a very bitter plant. Benon has this reed, and he says that this is planted deliberately in the front of his house because he believes that this is able to send away evil spirits. So this plant here is a common hedge. Benon says he uses it to handle allergies, and they pick up these leaves. They have quite a lot of sap. When you break it, you'll see the sap, but he dries them and makes a powder which he uses to treat all sorts of allergic conditions. Mr. Benon has kindly accepted to allow us into his treatment room. This is within his house, and the purpose is to understand, make a diagnosis, and be able to figure out the treatment. And he's demonstrating with the pipe that he uses to understand exactly what the cause of the ailments is. So I'm going to ask him to also show us how he's able to use the other tools. We can see he has on this flat basket, he has a collection of coins and other ornaments, and would want to know. Client has to pay, first of all, for me to offer the service. I can now use my knowledge on how the coins spread to be able to understand the problem. I also have a mirror in the corner. You can see the mirror over there. I look through the mirror and I can tell from what I see in the mirror the nature of the disease that this person is suffering from. He's showing us a certificate here, and he says that this certificate authorizes him to serve and provide a service. And this certificate is issued from the National Council of Traditional Healers and Herbalists Association of Uganda. Okay. He says that this association brings them together as practitioners, and they also get some sort of training. And I can see there's a signature from the president and the secretary general of the association, which is headquartered in Kampala. Client has now paid up some money and would like him to demonstrate whether there is a problem that the client suffers from. So as he's demonstrating, he's saying that the person who's paid this money is suffering from back pain and also has pain in the right leg as he walks. He's saying that this person is also suffering from chest conditions, especially when he wakes up in the night and he feels like he's submerged or covered by heavy objects. And he's saying that this person is using some Western medicines which help a little bit, but most likely the pain comes back. According to his revelation, he says he can see this disease. And he's concluded that the disease is a traditional illness and it will not be cured by Western medicine. That you will be fine, but the disease is within the family. So I'm asking him if he can manage this disease, which he says is coming from the family. He's saying this disease has its roots back in the family line and it can only be managed traditionally. We are at the home of a VHT, also known as a Village Health Team member. So I'll start by asking her what's her name and what kind of service does she provide.
Amazina ganje ndi omukyala natumanya Esther ndi omuhereza w'ebyamagara aha rurengo rwa LC1.
My name is Esther, as you heard, and I've been a VHT and trained since 2010, and I have a designation to look after 31 households. As you have heard before, a village health team member is the lowest level of healthcare delivery in our healthcare system. And the VHTs have the responsibility to reach individual homes and provide several forms of service. So I'm going to ask her to give us examples of some of the services she provides.
Nempereza bururengo rwona konke kikuru munonga nendebera munonga abana bagansi emyaka 5.
Okay, so I am a VHT, and although my designation is to look after health in the village, my focus is on children who are under 5, and I am critical to ensure that the parents with children under 5 ensure that the children are fed well. Nutrition is one of the things that is top on our agenda.
Nimba haburo kuba kubasa kurebera makagabo mbyo buyonjo bakabasa kwerinda endwara.
So my focus is on prevention, and I interact very closely with the families, do health education. Malaria is a very common disease in this village, and I speak with the families and educate them about prevention of malaria. For instance, keeping their compounds clean, slashing and keeping away the tall grass, and also sleeping under nets. I'm going to ask her about bed nets, because it's one of the methods for malaria prevention that has been promoted by the Ministry of Health, and I would like to know her role in this bed net program.
Omuntu umwe yatuherera obutimba, then twenkaba VHTs akatuhereza omwoga okubasa.
As a member of the VHT team, I was privileged to participate in the distribution of the bed nets, and this was a national program, and I took the responsibility in my village of doing a census of all the households and counting all those that need the nets, and we did a successful distribution for the nets. So I'm going to ask her about other services, for instance, related to pregnant women. How is she able to provide service to them?
Omukutaya kwanje ko mumaka nimba nimbuza abakazi abakiryo myaka yo kuzaara mubuza murembere yarumu twaganira munonga angambero kwakura kwakushasha then realizing amanya ngo yine kwasa kwa ine chai no maga.
So I take it upon myself as a recognized leader in the village to advise women who are pregnant to attend antenatal clinic. It may be considered as probing into people's privacy, but as a health leader, I feel that I carry that responsibility to ensure that pregnant women deliver safely. So I would like to ask her about any other services that she provides apart from those two services. So we play a critical role, and we collaborate with the health facilities. And for instance, the Ministry of Health has a program called the Child Health Days, and during these days, children who are healthy are given deworming tablets, and we play a role in distributing these tablets as we collaborate with the health facilities. Okay. So I'd like to ask her about how she sees herself, what positions she occupies, whether the community respects her, and whether they actually appreciate the service that she provides. So she says the VHT is actually selected by the community, so she feels privileged that she provides this service. She's certain that the community trusts her, that's why they selected her, and she also feels motivated to ensure that the community that she lives in is healthy and feels very useful because she contributes directly to the health of the community.
Right now, we have an estimated 1,200 to 1,500 outpatient attendances. That is by the end of the month, when we count monthly. Now, the deliveries range between 150 and 180. When the month is bad, then usually they go up to around 180, but that is usually the range, 150 to 180 deliveries that we handle. One of the issues, of course, that we are facing as a district is understaffing. Then, of course, there's also a limitation in the resources that actually trickle in to support these numbers of patients that we see. So, we receive supplies through the national system, and that is from national medical stores. And these supplies come in at least every 2 months. But I can tell you that in the first 2 weeks, literally all the supplies that have been brought start getting out of stock. And now you have to wait for another 6 or so weeks when patients are not accessing what they're supposed to utilize. So we have a very big challenge when it comes to that. This maternity ward, another example, is that it has about 6 midwives. 6 or 7 midwives. These midwives are supposed to provide all maternity and antenatal care services, as we had seen. So it also becomes very complex. Because having these midwives, you have day duty, you have night duty, and these midwives also need to be off duty once in a while, because you cannot expect them to offer quality services when they are also not getting some rest. So it becomes really a bit of a challenge. And this is one of the facilities where we have given more midwives, majorly because of the amount of work that they have. So you may go to facilities where there are 4 or 5 midwives, and they have to provide services to a number of women. So I think this is also another major challenge that is affecting our system. Yeah, but we are hoping that there will be some revision at the level of the Ministry of Health and Ministry of Public Service to ensure that we get more numbers of staff coming in to support these people. As a country, of course, we had a whole year, literally a whole year, where we had challenges with COVID-19. They were very major because this facility was one of the facilities that we had identified to work as an isolation unit for all the cases that came across the district. Now, one of the issues that we had was that even some of our staff, actually by the end of the year, we had registered about 8 to 10 staff who had tested positive for COVID-19. The advantage was that none of them had severe COVID-related illnesses. Yeah, but it was challenging. The access to services was also a bit of a challenge. We had a number of people who were, let's say, a number of people who had been seeking care in the regional referral hospital. But during that time, when there was a lockdown, people were not able to move. So while in so many places, the number of patients dwindled, here we saw an increase in number of patients because those who were not able to go to the regional referral then had to come to access services here at Chinoni Health Center 4. So it is a mix of a number of things. Right? We were not able to move, even the supplies are less. It was hard because even the health workers themselves, when they fell sick, then there was a shortage of staffing. So definitely this really affects the quality of service that you're offering to people. But at least in this era, we see that the number of cases have reduced. The country has already started vaccination. And this site is one of the sites that is actually offering vaccination. The launch of the vaccination program began here. And I was among the first people, actually I was the first person to take that shot. Yeah, but over and over, almost all health workers, we are at about 65% as of end of last week. We were at about 65% of all health workers who had received the vaccine. So finally, I would really want to appreciate our students for having considered us as well to be people that they can come and learn from or get something to learn from here. And we were hoping, I was actually hoping that they would come. If they had come, maybe this would be different. This is just a video, but at least we would have wanted them to get that experience and they really see what people go through or how things are moving in a country like this, and especially in a rural setting like this. But we look forward to continuing to work with you and hoping that you can learn something from this.
As you all recognize, this experience should have been right here in Uganda with us in the field, but it has not been possible. But I hope that through the experience that we shared with you in the field, you have been able to understand what happens in a global health system setting. We toured a health facility, and then we also toured healthcare providers in the informal sector. And we saw how Ugandans access health. We hope that you'll be able to join us next year. Hopefully the COVID epidemic will be much less as it has been this year. Uganda is rolling out several interventions, including vaccinations, and we hope that these concerted efforts will bring the epidemic down. I urge you to sign up and be able to travel to Uganda. I also urge professors and other academicians at Western University to come to Uganda and experience this fantastic country and climate and the learning opportunities that are available here in Mbarara University of Science and Technology and in our healthcare system in Uganda. I'm very grateful to Professor Eric Arts for allowing me to share my experiences with you, and I hope that this has been a very fruitful lesson for all of you.